Hi, I'm Dr. Rahul Meehan, and I'm a urologist here in sunny Arizona. I'm going to walk you through a procedure of a gentleman who had a urolift done a few years ago, but his symptoms have returned. He went and found a urologist who performed a urolift procedure, and for the first few months, it worked well. After that, his symptoms started coming back. I saw him. We did an ultrasound on the first visit, and I measured his prostate to be 110 grams. We filled out an AUA symptomatic score, and his score was a 35 out of 35. So I went over all the things that I do, and he's here now for Greenlight laser therapy. Here we go. We'll start taking these implants out here right away. Yeah, well, first let me, I'm gonna take out one of the implants just to kind of show you how they come out. The trick here is really simple. The beauty of this scope is that it has a laser bridge, and through that laser bridge we can insert this flexible alligator grasper. And the urolift implants just pop right out. It doesn't take that much pressure. It's like 4 pounds of pressure and it comes right out. So if you see one, you don't really need to do anything too fancy. You just go in there and grab it. And I'll demonstrate that here in the beginning. And what we're going to see here, this is what we call the stainless steel urethral end piece to the implant. And there it is right there. And all you need to do, same scope, just grabbing the end like this, pull, comes right out. Boom, that easy. And I like to look and make sure it's out. I just kind of keep track of how many I take out before. Just like that. Just kind of set that to the side and keep going. And I don't see any more that are obvious. A lot of times they kind of go underneath the tissue, and we'll find them with the laser. This is the 180 watt XPS Greenlight laser. We're using a moxie fiber because the laser is able to vaporize tissue at the 532 nanometer, which is the same wavelength as hemoglobin. So it's very hemostatic. As we're vaporizing, we're sealing the tissue. Here, what I like to do is tackle this median lobe first. So what we're going to do is create grooves on the side, and they're kind of already there. I think this is the bladder neck. And what I do is let's go in settings of 80. We're going to go in a low setting here.
80 to start, all eyes are covered. Take you on standby.
I'm going to make a groove here at 5 o'clock and 7 o'clock just to kind of push up the median lobe. Yeah, look at that. There's an implant right there. Yeah, so I'm going to come sideways now. So I'm not going down on the bladder. I'm away from the bladder. I'm right on the bladder neck. I'm going to preserve the bladder neck. And I'm just going to keep going at this groove. And look at that. Tissue is vaporizing very nicely here. I might work my way back. And there's my first groove. My second groove will be on this side. Essentially what I'm doing is like making a mohawk out of this central tissue, this middle lobe. And then we're going to vaporize and get rid of that mohawk. There's my second groove. Beautiful. So let's turn it up a little bit. Let's go to 120 here. And again, I'm away from the ureteral orifice. I'm going sideways here, completely safe. Bladder is distended. I'm going to keep the bladder distended throughout the whole case. I don't want to empty it. It really helps prevent bleeding. And what I'm doing here is kind of going underneath the median lobe, just teeing it up. Beautiful. And I guess there's not an implant here, as I can see. I don't know. We'll find out. At this point, I'm gonna move the fiber away from the tissue. The fiber is about 2 millimeters in size, and you really want to be about 2 millimeters away, something like that. The other thing I'm doing here is I'm choking up. A lot of people have the fiber way out here. I do better when I kind of bring it closer to the scope. Kind of like my golf swing. I like to choke up a little bit. I just get a little more control. And I'm just going to vaporize this median lobe. I'm just going to get rid of it. Just really nice and easy. I feel like I'm Bob Ross here, just painting a picture, making some beautiful clouds. We're just going real slow. And look at that. See how quickly and easily that vaporized? Gorgeous. Let's turn it up a little bit. Let's go to 180. I want to show you the difference.
180, ready?
Okay. So I'm in space here. I'm going to use the full power of this laser just to get rid of this median lobe. Again, I've detached it really from its base. So I'm in free space here. So I'm okay turning the power up. I'm not going to hit anything. I'm not going to cause any damage. Looks good. And that median lobe is coming out really nicely here. Oh, there is an implant there. Look at this. So there is an implant in the median lobe. We tried to pin it over and obviously wasn't able to get it. So I'll show you how I do this. This is implant number 2. All you need to do is just find it. Once you see it, you can pull it out. And I think I got a good look here. You don't need to cut the string or anything like that. If I want to get a better view of it, I can come on the other side of it and kind of encircle it. And I'll show you that on the lateral lobes, but on the middle lobe, you can do that too. So I'm going to kind of come around it, come on this side, come on and expose it. The one thing you have to watch out for, if you see the laser blinking, if it pulses, that's a sign that it's overheating, and it's probably reflecting off the implant itself. So there we go. I got it nicely exposed. We're going to turn the laser on standby.
Standby.
I'll take the alligator grasper, grab the end of it, pull it right through the scope, make sure I have it, which I do, and that's it. Look how easy that was. Boom. Look at that. Gorgeous. Zero bleeding, nice open channel already. What we're going to do is really just leave all this tissue intact. Oh, and this is pericallicular and collicular tissue around the veru. So probably about right here. I'm going to leave everything below it, behind it, alone. And I'm just going to vaporize here just to mark a line. I'm not going to go behind this area. We'll leave everything from there to there intact. We're at 120 right now. I'm going to keep it at 120. It's vaporizing very nicely.
Vapor.
And we're going to work up till we see some urolift implants. So I'm going to start here on the right side. So where are these implants? Where do people put them in? I actually do a lot of urolifts, and the goal here is to make an anterior channel. A lot of people put them at 10 o'clock and 2 o'clock. I have a lot of other friends that are putting them at 9 and 3 o'clock. So they can be anywhere up in this anterior channel. So when I'm doing a Greenlight, I'm going to start low and kind of work my way up until I find them. Starting at the bladder, working my way back. Gorgeous. And we'll keep going up. We're going to probably encounter some implants in this area, I imagine. This PET suture that's connected again to the stainless steel urethral end piece. And sometimes that capsular tab doesn't make it to the capsule. And taking that out is very easy as well. Sometimes that won't fit through the laser bridge. And I remove the laser bridge with the piece in tandem. I use the alligator grasp it, but the key is to really keep the scope in place so you don't drag that tab, that metal piece through the urethra. And this laser scope is perfect. Let's try that. Let's try the other lobe. Again, look how quickly I'm vaporizing at 180 watts. This is awesome. My typical, oh, there's an implant right there. Look at that. This is actually one of the capsular tabs. This is actually one of the capsular tabs, the 9L capsular tab. You can see it's like a grappling hook right there. So this is awesome. Okay, so I have it exposed. We can just pull it out with the grasper. I'm going to come underneath it a little bit just to get a little more exposure. Again, I'm careful not to laser right on it. Oh, there. I'm going to come above it. Open it. I've actually never broken a laser. Just got to be careful. Okay, there we go. So what I'll do is go on standby.
Standby.
I'll get the alligator grasper.
Alligator's acting up a little.
And this is not going to fit through the scope, through the laser bridge very easily. Take a look at it. See that? It's like a hook. So what I'm going to do is, I'm going to turn my water off. I'm going to open the scope. I'm going to try to get this through the scope. Let's see if I can fit it in here. There you go. See how that? It just fits right in. Scope's left in place. I got it removed. I see it. Awesome. Go back in and we're done. That easy. Step 3, so we've done the median lobe. Step 2, the lateral lobes. And I'll do some more in the lateral lobes. We're just kind of opening it up. The apical tissue will be the last part. And this is where the implants are going to be. And this is the thinnest part of the prostate. So I do turn the power down. I'm usually around 120 to 80 in these areas. Other keys here are I'm preserving the bladder neck as best as I can. I really try not to put a lot of heat or energy at the bladder neck. I think that's an important step when you're trying to maintain ejaculation and avoiding any kind of bladder neck contractures. One question I get a lot is how far do you need to resect? Do you go all the way to the capsule? And sometimes I do, but a lot of times I don't. It's kind of interesting. It's kind of humbling too to get an MRI after these patients' procedure and see a lot of the peripheral zone that's maintained. I'm really, again, trying to create a TERP-like channel throughout, and that is sufficient. So we've got a little bit of a bleeder right here. I'm going to go to the coag setting
Coag.
and just paint that with a coag. A lot of times, if we can't see the bleeder, let's go down to 120.
120.
I'm going to open it up a little bit so we can see the bleeder. Yes, good.
Coag.
And when I'm just sitting on it. I'll sit on it for a while. Yeah, a little bit of sinus here. Watch this. So look, it's bleeding, and if I put pressure on it, I can stop it, like putting your finger on a wound. We can kind of look at it. Huge channel now. Look at that channel. Here's another one, right at the bladder neck. Look at that, just right inside. Okay, so good. I got it exposed. We're going standby. Get this one out. Let's see if I can. Aha, well, that's good. We got another urolift implant out. And look at that, it's just still melting like butter. Awesome. We still have this piece. This is the median lobe that we enucleated and vaporized. We'll go to standby here.
Standby.
And I'll take a grasper if you got a grasper. And I'll actually remove this tissue and send it for pathology. And I call this a GLEP, a Greenlight enucleation. It's vaporization and enucleation. We have tissue to send for pathology. I have seen prostate cancer in these pieces, but I do screen them really well before. So this procedure is not to cure or to treat or to diagnose prostate cancer. But I do have some tissue to send, and we will send this. And watch how easy this is. I just grab it with the grasper, alligator grasper that we used before. I have it pretty small, and it just pulls out right through the urethra. Right, this is where I'm going to stop. I've created this humongous channel circumferentially throughout the prostate, from the bladder all the way out. Again, I wanted to spare the varu and create a hood of tissue over it. And this will help preserve antegrade ejaculation.